Good afternoon, everyone. Today is a special day. We have our own member, Shaukat Hussein, Dr. Shaukat Hussein, I should put it. And he's going to talk about his experiences in his own words. And he said he has a surprise. So I'm waiting for it. His primary education was done at Dar es Salaam, Tanzania. And in 1964, he did MBBS, LRCP, MRCS, I don't know, rest of them, University of London, UK. He worked 4 years in UK, then for 4 years he worked in Dodoma. Am I pronouncing it right, Shaukat?
Correct, correct.
Tanzania, 22 years in Musomin, Saskatchewan, Guelph, and Toronto from 1994. It's he says his great disappointment was when he failed Cambridge School Certificate exam in Gujarati in, in grade 12. And his great thrill was when he led the Division C school team win cricket league against Division 1 in his A-town teams. So that was his this thing. Physicians whose names are included in the Canadian Medical Register are known as licentiates of Medical Council in Canada, and he's one of them. Okay, and he's a consultant clinical hypnotherapist from the American Society of Clinical Hypnosis, and he is a very good speaker. Whenever he comes for our program, he articulates it so well, and it's very nice to listening to him. So welcome, Shaukat, and the floor is yours. Go ahead.
Okay, I want to first quickly thank Sachez and the team for organizing this. And of course, Sandhya and Shanta have put in a great deal of effort into this, as they always do. Thank you so much. I want to also thank my wife Razia for the strong shoulder that I have leaned on since we met in 1959 in London. We were in the same class in school in Dar es Salaam. I don't know if Shivdas is here, but if he is here, I want to let him know that Razia is right here listening, so you know what I'm supposed to say here. At this age, I'm sure a number of you, like me, sometimes think of the events in our younger days. What happened? How did we get to where we got? And quickly, I have very little time for this, but quickly, three things came to mind. One was the book I read, an autobiography of a yogi. And again, in that book, this yogi wakes up his disciples deep in the jungle and tells them at night around 9, 10 o'clock that four travelers are on their way here. It's very stormy outside, and please, they are hungry and thirsty. Please prepare a warm meal and warm drink when they get here. They'll get here past midnight. So the disciples questioned him, how could they ever do that? He said, I can see them. They are inching their way, they know their way, they are headed this way. And lo and behold, they were all there. And the meal was prepared and they had. I closed the book and I said, my God, the power of the mind. How could this yogi ever know that this was happening? Fast forward, second year clinical medicine, 1961-62, I read a book, Sense and Nonsense in Psychology. A very boring book, boring. But I hung in there and I came to a chapter on the power, and I love this power of the mind. So this was the power of suggestion. And these 5, 6 specialists who practice this, they decided, why don't we meet and discuss what's going on here? What is it that really works here? And they met, and 5 of them were sitting there. The sixth one came, and one of the 5 says to the sixth one, he was going to sit on that chair. He said, I have to let you know. Last week we had a meeting here. And in that meeting, there was a guy sitting in that chair. In 15, 20 minutes, he became very uncomfortable. I know all the chairs are exactly the same. But he stood up and sat right on that chair. So this guy tells them, hey, I know all about this. You are trying to suggest to me that I sit on that chair and not here when they are all exactly the same. Oh, no, I didn't mean that. Please, I am just letting you know what happened. So the guy sat there 15, 20 minutes. He became restless. He stood up and he told them, I really don't care. I don't care what you think about me, but this chair truly is uncomfortable. Why is uncomfortable? I don't know. And he stood up and sat right on that chair pointed out to him. So here I'm in clinical medicine. I told myself, well, I'm not going to be a psychologist, psychiatrist anyway. So forget it. I want to finish first my MBBS, get on with internship, and see what I'll be doing. Most likely internal medicine. So this experiment just was at the back of my mind. The third thing is one sentence only. Like all of you, some of you are in the same era as I am. Mahatma Gandhi's teaching and doctrines, it infused in us. We didn't have to go to a class or evening class or a lecture. It just did. So I'll move on from there. These were the 3 things that my mind went back to. Now, quickly, my introduction, what Shanta left out, I can quickly tell you about the event that took place, and that will introduce me to you. This was a 8, 9-year boy with a bellyache. I checked him and didn't seem to be something very serious, no fever. So I tell him, Christopher, I took his arm and showed him his elbow, and I said, you see that vein there? You go and tell that nurse in the hospital across the road to take your blood and give him a sample of your pee so we can find out what's causing your problem. So the mother, after they had been there, came back and she said, you know what happened? I said, yeah, tell me. And she says, he did exactly as you said. He told the nurse, just from here, not from the shoulder, not from my wrist. The doctor says here. And then the lab technician asked him, Christopher, do you know your doctor's name? So the mother says he proudly looked at her and he said, of course I know his name. His name is Dr. Insane. So there you have. You're going to have to listen to this Dr. Insane a little while longer. So in 1972, lots happened in Dodoma, in England, but what I want to concentrate is 1972, we landed up in Moosomin, Saskatchewan, a town of 2,800 people, a perimeter of about 4 kilometers, but this town had a 50-bed hospital. My dream came true. A lab, an X-ray, a maternity ward with 2 beds, a pediatric ward with 2 beds. It was just my dream came true. Everything is there for me. And education up to grade 12, very good teachers, a golf course, a swimming pool, a curling rink, a skating rink, you name it. So it seemed like a right place to settle down. So I got down to regular practice. And very quickly, I had to learn, my goodness, I'm not equipped to cope with this. So I started going to conferences, basic cardiac life support, advanced cardiac, basic trauma, advanced trauma, general anesthetic, nerve blocks, regional blocks if I am alone and nobody is there, and so on. Neonatal resuscitation because I was doing deliveries. And I just went on that way. And I have just one example of a patient that would tell you how I had to go that way. And this is after about 10 months or so. This woman, around 50, she just stands in the office there and she say, you know, doctor, you know both of us, don't you? You know John. I said, yes, yes. Lately, he hasn't been paying any attention. I don't know what's happened. So the obvious question is there somebody else in your life? He said, no way, no, nothing. What about him? I know him so well, I am quite sure of it. Now here I am stuck. I never dealt with a situation like this. So I said, I would want to buy time. I said, come back in a week, please. Okay. I bring John, and it takes two to tangle here. So I was buying time and no internet, no library, nothing. And the next referral center 140 miles away. I would be ashamed to say I have to send you to the whatever therapist is in Regina. So 1 week went very quickly, and here they're standing. And I look at the chart just to buy another, maybe half a minute or so. So I said, John says, my wife says, you want to see both of us? I said, yeah, yeah. And suddenly it hit me. I had no idea what I was going to say. I never tackled this kind of stuff. Give me some bronchitis or anginal pain or high blood pressure. I could deal with it. So I said, John, tell me, when did you last hold her hand? So John says, I hold her hand all the time. Look, ask her, coming here. I was holding, I said, no, 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 John, you didn't hear me well. When did you last hold her hand? He said, I just told you, you better ask her. I said, no, no, let me tell you again. When did you last hold her hand that your palms became sweaty, your heart was pumping away, you felt like your chest will break open? So he looked at me and he said, I know what you are telling me. That's it, doc. That's it. I got your message. And they left. But you know, when that woman told me about this, her complaint, it was like somebody took my shirt collar back and stuck three ice cubes down my spine. That's the feeling I had. And that taught me, in this little town, hey, you are the doctor and I have this problem and let's sort it out. So it involved everything, right? So here I am. After having learned all these things, I came to a roadblock again. And this roadblock was my patients who had, like, sometimes I don't like the term. It's called psychosomatic. I don't like it. But they really suffer migraine headaches, tension, can't sleep, and this kind of thing, chronic back pain, and so on. And these people were good for the wallet, but these patients never good for your heart, you know. Your soul doesn't take it. I had to find a way. So quickly, in one sentence from the Hindi movie, I was at a jitna aage jaऊं gahera hota jaye. In one sentence, that's the feeling. Constantly worrying about them, having to find a solution. Not this migraine headache, come away, come back, you're taking your medicine, you still have the headache, go and get a shot. You know, that's not the treatment. So there was no acupuncturist in town. So I thought maybe acupuncture can help. So I went to intensive care for 4 days, learning 20 different points. I came, and one of my migraine patients, I had a good rapport. I stuck two needles here, twiddled it. My God, the pain went away. 10 o'clock at night, she calls me, doctor, my pain is back. So I say, okay, go to the hospital. She give you your regular needle, you can sleep it off. Then I thought further, this is no good. Then it occurred to me how, if I use these two needles and follow it with a suggestion that this headache will not come back, that's not part of you anymore, and so on. So I started a course, conferences in clinical hypnotherapy. This is organized by American Society. I believe it's from Chicago. And I went to 3 or 4 conferences. The same patient showed up, and I did what I planned to do. She tranced well, her headache went away, and lo and behold, no call. And I didn't see her for 8, 10 months. When she comes for her physical, I look at the chart and I said, you know, Pam, ever since I cured that headache of yours, I am going broke here. So she laughed, she said, "Sir, 10 patients are waiting for you. You won't go broke. That was fun. That was real fun. It was the first real reward I had from pushing forward and forward to try and find answers. The second case I'll quickly go to is a young fellow in his late 20s, about 28, a family, one child, and it's a 50-bed hospital, so you know what's going on. And he was admitted by my colleague for headache. Started at 3 in the morning. He showed up there, and he was getting shots about 3, 4 times a week for 4 days. So he referred her to Regina to a neurologist. This guy came back on 3 or 4 medications, and his headache was under control. He wasn't my patient. So 6, 7 weeks later, he shows up in my office, and this young man is crying. I said, why are you crying? I had heard that you had this, you went there, and you come back, and you are fine. He said, no, the specialist told me that this type of headache can come back every spring. So I want to warn you, he says. Now you can see, I don't have to explain to you. This is a seeding of an idea that comes from very high up. This is a specialist. Who am I going to counteract here? Right? So I said, right now, I don't have time to come tomorrow morning. I'll see you in the outpatient clinic in the hospital, and I'll make sure I make time for you. So I explained everything to him, what we are going to do. So obviously, a seeded idea, you have to supersede it. So he went into a trance, and it's very obvious, even you will know. The best thing for me is to bring out all the pluses of the spring season. So I got him through all these nice things that happen in spring. I'm going to cut it short, but you all know. The leaves begin to show up. The earth smells so good when the rain falls. We look forward to spring showers. The sun is so gentle on the skin, etc., etc. And the suggestion was simple, that you will actually look forward to this season because it's one of the best seasons. So what happens? He comes the following summer, midsummer or so. He's not my patient. He continued with his own doctor. So I said, how are things? And he said, I didn't come for any treatment. I've just come to thank you. I had this little inkling of a headache, and I had I've never had spring like this. So you see, sometimes a little extra effort was very rewarding for me. I felt so happy for him. So the third one, the other case happened to me when I went to a conference. Whole week of intensive hypnotherapy conference. Saturday morning, there are trials. People, we sit together and we work on each other and see. So my challenge was, you will get this person in a trance, you will not touch, and you will not speak, and then bring her out from that trance back. That was a challenge. So in my challenge, my subject was a family physician from Maine, a woman in her late 30s. She had brought her nurse practitioner with her, and there we were, six of us, and I was supposed to hypnotize her, whatever I wanted, whether I want to use imagery or something else, whatever, and get her back, but without doing anything at all. So here we were. She was very good subject. She was from Maine. She loved kayaking. She loved canoeing. So here I used the imagery again that she was at this nice lake side by the beach, and she was got into a canoe, and she sees all these ripples and all this in detail. She comes to the center of the lake, and I suggested to her, you stop here, you want to really enjoy what you are doing. And slowly I suggested that everything dies down, everything goes away. The wind, the gentle breeze stops, the ripples stop, the birds have gone away now. In other words, this is the expression I use, that you are now experiencing what I call crystal clear stillness, absolute stillness. Fine, that went well. What am I going to do now? And I was stuck again. I didn't know what I could do. So I waited, and the professor was making rounds, looking. He comes, he looks at me, and he gives me a smile, telling me, I know you're stuck. Then he went away. He came back. He went away. And suddenly I thought, how about if I put myself in a trance and I go to that beach I described for her? And in my trance, I call her, it's time for you now. You can start rowing back. The birds are back, the leaves are rustling. So I did that. And then I came back. My colleagues watched me, and it seemed like we had to wait a little longer. Then she flickered her eyes and she looked at us. Now, this is what I can't explain and I can't do ever again myself. I don't have that ability. But she told us, you know, I saw you on that shore and I heard you tell me it's time for you. You had a lovely time. It's time for you to canoe back and be with us here. This was a shock to me. But it led me to believe that there are times when, without saying, without talking, we can connect with people. But similar case, I don't know if I could do it. Have we got time yet, or where are we now?
No, we have
Yes, Shaukat,
time.
you have time. Yeah.
Okay, good,
Lots of
good.
time.
There are three or four things very quick again. There was one woman, a farmer's wife. She came. She would be about 50ish, and she just had difficulty sleeping and a bit tense and this. So I said, okay, we'll see what we can do. And I just did explain to her everything, what we're going to do, and she relaxed. She went in a trance and she went home. 4 days or later, she was supposed to come in a week. 4 days later, she calls our assistant receptionist at the clinic. No, she came. Sorry, she came. That's the other guy. She came and she sat down and she tells me, you know, doctor, I'm sorry. I don't want to have another session. I said, that's fine. We don't do anything we are not comfortable with. So she said, you know, I didn't tell you my history. I had lost vision on each side. I couldn't see for 2 years. I had seen two ophthalmologists, two optometrists. They all kept telling me my vision is good, but I couldn't drive because I couldn't see. I stopped driving even the truck on the farm. So I said, what has that got to do with the situation? She said, I went to Regina 4 days after I was here. That Regina is 135 miles away, it's a city. And suddenly I told my son, why don't you just park the car there, move over, I'm going to drive. So he said, Mom, you can't see it here. And he described everything in detail. And she said she drove, she came back, she drove on the farm, she drove to the clinic. And she said, I'm afraid if I go into a trance, it may come back. So you see, she had, for some reason, blocked her vision. And that's why every specialist was telling her, your vision is good. But she had blocked it out from some form of internal tension. I had moved on now. I didn't want to worry about people's complaints. My thrust moved on to assisting the individual at a deeper level, finding the solutions to what is upsetting them. That's where I had moved. Who am I to tell somebody you sit here and you sit there? No, that's not my job. My job is just to assist the person to get to where they want. They will find where they want to go. So that was that experience. One more for sure is because this next case shows it's not all about hypnosis and putting a person in trance. And this case shows us very well. This is about an accountant, around late 30s, married, two children. It's like a typical story of a nice bungalow with a white picket fence, etc. So he wasn't my patient. He heard about me and he just came. And this is his story because where I trained in London, listen to the patient. He's telling you what's the matter with him. You sometimes don't have to examine anybody. And this guy, he was a self made man. In school, he worked hard, he met his expenses. In university, he put himself, he worked hard. Then he later on got married. Everything he did not get any help. What is his problem? His problem was simple. Every day he had to smoke 3 small cigars. One cigar in his noon break, one cigar when he reached home, one cigar later in the evening. And he said, I cannot stop this. I don't want to have this habit. Now, can you imagine somebody who is self made, who put himself through all this? He is facing a challenge. For the first time, he's telling himself, I cannot do this. So I explained to him a great deal about smoking. My approach was totally different from I never mention emphysema, cancer, bladder, and I just don't talk about that. So he had one session and he had, according to our training, all the responses were excellent. And I was very hopeful, this is it. So he came back and he said, no, we had a second session. Again, he left. So what I did was I couldn't believe it. I was just, what's going on here? I took his chart home and I looked at his chart and again I went back to the first principle, listen to the history. What is he telling you? And it hit me there that he's told me that in the history, not in these words, that everything I have done it. So he came for third session. And I saw him and I said, how are you? He said, no, I'm still exactly 3 cigars, same time. So I said, we are not going to do any hypnotherapy today. So he said, why not? I thought it was going to help me. So I said, last visit, the very first visit, not last, the very first visit, you had the session, you went out to the parking lot and you lit a cigar. And that's not the time you normally smoke even. He said, how do you know? Did you follow me? I said, no, you can see there is no window in this room. And I had the next patient here, but I thought about you when I went home. And why did you smoke that? I can tell you. You may not know, but I can tell you. In your mind, after you left here, you were thinking, who is this little doctor that I need help from to stop smoking? He's done everything himself. He's been in charge. So I said, this is my diagnosis here. You have been in charge and you do everything yourself. You're not going to take my help to do it. So why don't you go home for 3 weeks and do me a favor? Just give me a call. That's all I want to know. And the message was clear. You're going to do it yourself. You don't need any therapy or this or that or any suggestion. And lo and behold, around 3 weeks, the phone came. He said, thank you so much. I've stopped everything. So here, you see, it's not putting a person in trance, it's not. It's knowing and connecting with the person's history, his mentality, what kind of person he is, and then guiding him along his path. It's like walking the walk and talking the talk, right? I talk something else and he is talking, it doesn't work. We have to walk together. So that I thought was a good case to bring out that it's not all about trance and suggestions and all that. If you have time, I'll give you the last case here. Then I have several, but there are two actually, but this one is also very interesting. My good friend, a doctor, very, very good friend, very nice man. He referred to me a patient. This patient was in her 60s. So he sent me the history. She had colon cancer, which had spread all over. And they had given her about 6 months. So I looked at the history. I said, what? Friends like this? I said, what am I going to do? Like, what can you do? They had given her 6 months. She knows about it. She is supposed to start chemo, but they told her it's unlikely that it will save her. Holy, that was the toughest one I had to face. And so I said, my job will be only to assist you and see if you can, in whatever way, you can stay a little relaxed in what you're going through. Talk about relaxing when you have a threat of going in 6 months. So she had one session. She was coming from way up in the Kitchener area. And she tranced very well, obviously. She had motivation was there and she had this threat and the biggest fear when we are dying is that as soon as we die we are alone, we can't, kuch saath nahi jayega. That's the saying, isn't it? Nothing will go. So that's the fear, right? So luckily she came second time and she started talking to me more. And she was telling me, I've been reading about this, and we have these fighter cells in our body, and they do fight a lot of things, and when we have infections, they really help us. So I got a clue here. So under the trance, I suggested to her to visualize these cells and to to also visualize that they don't just fight the viruses and bacteria and maybe even cancer. They are our guardians. They protect us. And these cells will let you transition from here to there. And my last point to her was, remember, you are never alone. You are never. The fear of being alone had to be tempered with. And this is what I told her. You are never alone. Those fighter cells are still with you. That's what they are there for. I haven't had a smile like hers when she came out of the trance. And then she told me, I'm starting chemo next week and I am from a long distance, so I may not see you again. But my point here with this patient, no matter how hard it is, no matter how hopeless things look like, we can always do something, a little thing, and it goes a long way. So, you have time? What do you want to do?
We do have time.
Yeah, if you have time, I can tell you um, some things like how patients, you can empower the patients so that I don't need them to keep coming back. I don't have time. It's poorly paid anyway. So um, a smoker, past 50s, he had one session, right? Fine. And I went through a lot of detail on smoking. As I said, I don't talk about the effects of smoking. Smoking starts from the time Johnny gets a little quarter in his palm. He's itchy to spend it. So the exchange of goods and money is already established. I give the money, you give me the cigarette box or a cigarette carton or whatever. Anyway, so he called about 4 days later, and the receptionist came and she said, they don't appreciate what you do for them here because every time, every patient I saw, it was after I'd finished the clinic at 5:30, 6 o'clock, and I needed 45 minutes. So it quite often delayed me for supper, etc. She knew that. So she said, they don't really appreciate you put in this time and this. I said, what happened? She said, this guy who came last week, he told me quite rudely. He said, you tell your doctor I don't need his help to stop smoking. I can do it myself. I'm not coming this Friday. But she said he was rude. I said, no, no, no. This is music to my ears. Who am I to tell you don't smoke? No. Our job is to empower him to take charge and stop smoking. She was surprised. She said, really? I said, yes, wonderful. I don't want to see him again. It's good. So that's again, it's letting the person somehow work it out. I don't know how they work it out. All we are doing is facilitating the individual. And the last one was a panic attack. I had a clinic close to the Guelph General Hospital, and suddenly a call came, and they said, "We have in the emergency, we have this patient here. She is in a severe panic mode, and she is a hypnotherapist. So would you mind seeing her now?" I said, "Okay, you send her over, just close." So she came. She's in a very panic mode. They had to first calm her down. She knew what we were going to do. She was amenable to therapy. The history is important here. What's the history? She thought that, hey, if I study some hypnosis and hypnotherapy and this and that, I can hang the shingle up. Now, we as doctors, we not looking for patients. We just, our own patients are more than enough for us to select and say, this person I can help, this person I can help. So, but she was with a big sign on her car and positive change and everything. What happened? This particular case she was working with, she regressed herself. She regressed and went to through some traumatic event that put her in a very panic situation. So why I'm telling you, I had 3 sessions with her, and finally I advised her it's best that you go to these conferences, learn it, because you really have to deal with yourself first before you can deal with somebody else. And it came to that. But this, I never had this kind of situation. It told me how a person can get in trouble with inadequate training, and it's good to get trained properly. And this little boy, 10, 12-year-old, giving his in Musumin problems. So the parents, we all know each other. They say, would you mind seeing him? I said, yeah. So he had about 3 sessions. Fourth session, he comes. How are you? Oh, no, not good, doctor. What happened? Yesterday, I punched a hole in the wall. I was so angry. Oh, I said, you punched a hole in the wall? Which arm was it? No, this arm. I felt, and he was a well-built, muscular kid, you know. I said, amazing. You can punch a hole in the wall that thick, you know. Amazing. You are so strong. So he looks at me and says, you're not angry at me? I said, no. I am looking at your strength here. It's amazing what I can do, what you can do with it, how we can work on it, what we can plan. Well, my parents were very angry yesterday. So we worked on maybe he could become an RCMP, he can use his strength to protect people, and so on. He was very happy. 3, 4 days later, I see the parents across the street and they're just smiling at me. What did you do to this guy? So that's all I have. I can go on, but we don't have time. If you want racism, I can give you a case or two.
Yeah, please do so.
Okay, this one, the racism is very tricky situation. It's all underground. It's very hard to find. So what happened? We were 2 doctors at the time. Out of 3, the surgeon had left. And this doctor hardly ever took any time off. He was of Scottish origin. His father used to be a doctor in Manitoba too, and so on. And he was an old hand there, big guy, you know. And he always had a lot more patients than I had in the hospital. It never bothered me. So here he is away for the weekend, and I'm doing my round. And in this ward, there are 2 beds in this room. So one of them is my patient. So I went with the nurse and we talked about and finished. And we went out. So I told the nurse, you know, that patient next to her, I know she is not my patient, but she's so short of breath. I can't believe it. What are we doing for her? So she said, you know, she is this other doctor's patient, the white doctor, and her husband has said, no matter what happens, you will not have this doctor see my wife because he is a brown guy, right? He's a brown guy. So I said to the nurse, you know, you go back there and I don't care about her husband. This is the person who is suffering is her decision. Tell her, I worked in chest hospital for 2 years and I made this situation very comfortable. She was dying from cancer of the breast and there was a lot of fluid buildup in her chest that needed to be tapped. And I used to tap 3 times a week for 2 years and take biopsies, etc. So it was not a big deal. I said, you tell her I am prepared to help her and it will help her breathing. So when her husband comes, she would be much better and not beings not be so short of breath. So she agreed. I went there. I tapped more than a liter and a half of pleural fluid. And you know those things when you tap 50 cc's to 100 cc's, the edge is off. The shortness of breath that I'm going to be able to breathe now. And of course, she felt comfortable. Husband was a little upset when he came on Monday. The nurses kept it all hush hush, no problem. 2 weeks later, same thing happened. My colleague was away. But this time there was no explaining. The nurse just told me, just go and do it. We'll see. And I did it. And 6, 7 weeks later, she passed away. And about 2 months later, the husband shows up in the clinic. And he said, I'm sorry, I thought of you like that, but I want to thank you for making her comfortable. That's 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 the racism. Racism, a guy with severe short of breath, emphysematous, bad chest, and the colleague is away and they come to my clinic and say, can you prescribe this? I said, no way. I have to see him. That shortness of breath could be lungs or it could be heart. I give you something and I'll finish him. They came again. They went to him. He won't agree. They told me he won't see any other doctor but white doctor. I said, there's a doctor 30 miles away. He's white. Why don't you take him there? But he has to be examined. Finally, he caved in. And I tell you, today I look back, maybe it's Gandhiji's teachings, you know. I went there and I quietly sat there. I filled up 20 cc's of aminophylline and I slowly injected while I was talking to him. I watched him, his breathing improved. It was so satisfying. And he looked at me and then I said, you know, if you hang on to me, I'll give you a ride to the hospital. Because if I call the ambulance, cost him $45. I said, either I call the hospital or you come here and gently walk slowly. And I spent more than half an hour there while my clinic was full, and he knew this. I took him to the hospital, I got his x-rays, IV set up everything. And he got better care because son of a gun, he was a racist. You know, the other people wouldn't have got that care. Anyway, enough from Dr. Insane now.
Thank you so much.
Any questions or comments or anything?
You can unmute yourself and can they unmute?
Kunal, I think has, yeah, Kunal, you can't? Yeah,
No.
you can't unmute, is it? 1 second.
Okay, now I think I am unmuted.
Yeah.
Dr. Shaukat, I found it very interesting. All your stories are very interesting, and
Yeah.
I thought you did a great job.
Thank you.
Wonderful.
Thank you.
Yeah, we have to reflect that same thought. We too thought that was a very good presentation. Found it very interesting to hear about all the patients you were dealing with. But Chitra has a question, and the question is, under what circumstances does hypnosis work best?
Yeah. Well, I had an advantage, as I said before, because in family practice, you have these situations where you can feel your way around that this person I may be able to help. And this person, it sounds like I may not. If I had known the smoker who said, tell that doctor of yours, I don't need him, maybe I would have said it won't work. But if you are genuinely into the therapy mode, somehow individuals just need a little bit of guidance, you know, a little bit of a way around, or even a look at their problem in a quiet setting And, you know, a person's answer to his problem is not my answer to the same problem, right? Each individual. So here again, I was lucky. Our training based on history, listen to the patient. And majority of what psychosomatic, like migraine headaches, triggers of migraine, cluster headache, like that guy had at 3 in the morning, um, chronic pain. Chronic pain. Sometimes you don't know what you're doing, but there can be help. And I had a fracture, 2 fractured spine that had healed, but you know, I know that fractured spine pain doesn't go away. Even though the spine had healed in this way, it never heals in a proper 100% the way it was before. So this guy, not my patient, comes and I did about 3 sessions. In the 4th session, he tells me, I said, I don't know how much I can't reverse this. So he said, you know, doctor, I was taking 2 Tylenol three times a day, and I stopped it. I said, I never told you to stop your medicine because you need medicine for your pain. If you have pain, you need it. I'm a doctor too, right? I have prescribed it. He said, no, with and without Tylenol 3, I'm the same, he says. You see, he figured it out. I never suggested, I never talked about his pain. In his quiet moments, subconsciously, and I didn't have time to explain how this whole thing works, but basically, our subconscious strength is extremely powerful. And it is in the hypnosis, you help the patient gain access to that strength.
Mhm.
How? By subduing the conscious completely, as much as you can. Because it's this conscious that keeps hammering at us. So assisting him that way, and he found that he must have thought himself, if I don't take, what happens? So there are several things. Obsessive compulsive are very difficult situation. Depressed patients are very difficult. Contrary to the belief, depression, you know, is depressed, everything down, everything. Thinking is down, mobility is down, drive is down, sex life is down, you name it. That's why it's called depression. Now, hypnotherapy in the individual requires tremendous energy, and they don't seem to have it. It's very difficult. I can't remember having treated a very depressed person and getting good results. I can't remember that. It can be, and medications sometimes create havoc. A lawyer who suddenly feels, you know, if he was in the room arguing a case, he has to go to the bathroom. So what happens? He starts taking laxative at night, worse and worse. His wife leaves him. This was a psychiatrist patient. He is on 4-5 medicine. He asked me to help him. I said to the semi-retired psychiatrist who was coming to spend weekends 35 miles away, he had a family farm. I said, what am I going to do? He's under your care. He sees the therapist. He sees the counselors. He's done. He said, no, I think you should have a go. I think it'll work. And how did it work? I didn't have a clue. I didn't want to do this. I didn't want to see him. But he comes. And there we are, we sat down. And I still don't know what I'm going to do. What am I going to do here? So I looked at him and I said, may I call you Malcolm? He said, yes, of course. I said, please call me Shaukat. And then I took my stethoscope out here and put it on the table. And I said to him, I am de-doctoring myself. How about you de-lawyer yourself? So we'll be very
Ah.
equal footing, you know? Now this somehow had a dramatic effect. Why? Because I could see that glimmer in his eyes, that happiness that the eyes reveal. My God, if I am not a lawyer, oh God, I don't have to take any laxative. I don't have to do this. I can live a nice, normal life, right? Right? Now, I don't know. I could never plan anything. I didn't do anything. I just sat there and I said, first thing I have to do is get on a level plane. And of course, subliminally, I am suggesting to him, look, I am prepared to be doctor myself. What's the big problem here? Right? Characters, personalities, this thing come. But I think when I saw him, I had fair amount of experience in this field. And I don't know. I don't know how it comes, it just, but I've had a good time. And this is where the rewards came. The biggest reward I had is in some of these patients, and you can't beat it. You can't beat
Shaukat,
it. You can, if you don't, your wallet keeps becoming bigger and bigger. Sorry.
Bashir, please go ahead. Bashir
Yes,
has a question.
okay. Actually, I have a comment and a bit of information to provide.
Yes, sure.
I have known Shaukat for a long time. He's a very close friend. And not only is he a medical doctor, but he's a very caring, kind, and a compassionate one. And not just a doctor, but as an individual as well. Now, so much appreciation was expressed by the community in Mosumi, where he practiced for a number of years, that when he retired, the Mosumi Council passed a resolution dedicating a lane in Mosumi after his name. So
Very
now, if you go to Mosumi, you will find that there's a lane there that says Hussein Lane. And that's all because of the kind of service that he provided to the community there. I had to say this. I'm
Thank
sorry,
you.
Shaukat. I
Thank
hope
you.
this
Not
doesn't end
insane
up.
No,
lane,
no,
right?
thank you.
Thank
Thank
Thank you, Bashir.
you, Bashir, to telling us. Otherwise, we wouldn't have known. And it's not
Exactly,
insane lane, it's a Hussein.
exactly right.
Wow.
Hussein DR, Hussein
Yeah.
Drive or Hussein Doctor, it was named, yeah.
Yeah,
Wow.
very nice.
22 years later, they knocked down the old hospital
Oh,
and built a new one a kilometer out, and they made a road there. So they called it Hussein Drive, Hussein DR.
Oh, that is great. After 22 years.
I was invited there. We went there. Razia and I went there. There was a 250 people banquet. There was a couple that came all the way from Calgary, 700 miles away. They drove. So I met
Wow.
a lot of people I hadn't met. And that's why they told me the last house call was done by this Dr. Insane in 1994. There are 4 doctors, they don't do house call. I can't imagine that, but that's how, 4-kilometer radius, you don't do a house call? Hello? I've done house call from here, north of Bower Drive, 3 times in my life. 8 years ago, I went to see one patient. 3 times I made a house call from Bathurst and Lawrence, where I lived, north of Bower Drive, past in Brandon. Yeah, I went there, I did. But that's life, you can't have all a bed of roses, And
that
I didn't feel bad about it.
that shows your dedication to your profession and as a human
That-
being. That shows. Yeah,
That's what we all are here. All of you here, where I read you, there are amazing people in this group.
we are very lucky to have you.
Yeah,
Thank you for the
thank you.
beautiful presentation. Mahesh, you want to say anything?
Yeah, first of all, Ramadan Kareem to all of you who celebrate.
Thank you.
Yes.
Yeah, insane. I guess like you have so many quotes you remember now and kind of recite them. These are very important in my life. I mean, I go by quotes. People who know me see me posting quotes every other day, every other week. So when I wake up, I need to look at something new, a new quote to keep me going. And I think hypnotherapy in my life started a very long time